Hey, so good afternoon, everyone. We're just a couple moments past 1:30 Eastern time, so I'll just slowly start doing our official welcome. Um, so welcome to today's webinar titled Nursing Retention Toolkit, a Primer for Nurse Educators. My name is Christine Crosby. I'm the Managing Director of Strategic Initiatives here at the Canadian Association of Schools of Nursing. And before I jump into more information about today's presentation, I'd like us to just all take a moment and pay respect to the lands on which we are situated. I am joining you today from Ottawa, Ontario, where it is a beautiful, sunny and warm fall day, and I hope you're all having good weather wherever you're joining from. I am so grateful to live and work on the traditional territory of the Algonquin people, who have a longstanding relationship with and are traditional guardian of the land where CASN's office is located. This territory remains unceded. I want to pay respect to Indigenous leaders and knowledge keepers here and across all regions of this country. So today's webinar will begin with the presentation and will conclude with time for questions. To submit a question, I would ask that you please use the Q&A button at the button at the bottom of your Zoom window or raise your hand. We encourage you to use the chat to discuss and share with your fellow participants. However, the chat will not be monitored for questions for the presenters. So again, please use that Q&A function at the bottom of the Zoom window to submit your questions following the presentation. Please note that today's presentation will be recorded and posted on CASN's YouTube channel and will be circulated to the registrants for today's presentation. So now I'm pleased to say that we are honored to have with us Dr. Lee Chapman, Canada's Chief Nursing Officer, Yasu Yacob, the past president of the Canadian Nursing Students Association, and my colleague, Dr. Dawn Flaming, CASN's Managing Director of Education and Policy Initiatives. Dawn is presenting today on behalf of CASN's Executive Director, Dr. Cynthia Baker, who could not attend today's presentation due to illness. So thank you so much to all of the speakers for coming together for today's presentation. And with that, I will turn things over to Dr. Lee Chapman.
Amazing. Thank you so much, Christine, and to CASN as well for organizing this event. Really excited to be reaching all of you so early in the start to the academic year, and hope that this is you will find this information useful. And I just will acknowledge as well that I'm joining you from Treaty 13 territory here in Toronto, which is the traditional territories of the Mississaugas of the New Credit, the Anishinaabe, Haudenosaunee, Wendat, and Huron peoples. So I will talk more about the retention toolkit, which is why we are all gathered here today in this Zoom meeting. But first, I thought I would talk in very general terms about my role, because I often get questions about the role of the Chief Nursing Officer. So we'll go to the next slide and I'll talk about that. Thank you. So I have been in the Chief Nursing Officer role now for 2 years, since August of 2022. And I always just start by mentioning that this is a really key federal role within the federal government. It's a role that has existed in Canada since the late 60s and was eliminated in 2011 under Harper's Deficit Action Reduction Plan, but reinstated really as a result of advocacy from within the nursing community. So my role entails providing strategic advice from a nursing perspective within the health policy branch of Health Canada. I play a convening role. As you know, healthcare is funded federally and administered and managed through the provinces and territories. And so we play an important convening role from a leadership perspective as the federal government. And then I represent the government of Canada, both within Canada and internationally, although most of my work has been domestic since my appointment. There's been some international work. And in fact, some of you may have been in Montreal last July at the International Council of Nurses Congress meeting, which was very exciting because we welcomed over 6,000 nurses from 130 countries around the world to Canada. So that is really a Coles Notes version of my role, and I will pass it over to Iyasu to talk about CNSA on the next slide. Merci.
Alrighty, hello. My name is Yasu. I am a fourth-year nursing student at the University of Alberta, and I serve as past president of the Canadian Nursing Students Association. I would like to acknowledge that I'm currently situated on Treaty 6 territory, which is a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, and Inuit peoples, and many others whose histories, languages, and cultures continue to influence the vibrant community which I live, work, and play in. Since 1971, the Canadian Nursing Students Association has been the national voice for nursing students in Canada in registered, diploma, and psychiatric programs with over 25,000 members. We offer scholarships, discounts, coordinate virtual and in-person meetings throughout the year, engage in advocacy with multiple levels of government, and represent nursing students to partner organizations such as CASN, the Canadian Federation of Nurses Unions, and the Canadian Nurses Association. As you can see at the bottom right-hand side of the image, this photo was taken from the Nursing Retention Forum that took place in June 2023 that was put together in support of the development of the toolkit and features many of the advisory committee members of the Nursing Retention Toolkit, which we will be discussing today. I served on that advisory committee in my capacity as president of the association, and it was a very collaborative process as we convened representatives from folks in unions, professional associations, regulators, and government to work towards the development of the toolkit that we're now presenting today. Next slide, please. So this slide just shows a little slideshow of some recent CNSA initiatives and activities, just so you get an idea of like what we do. Clockwise from the top right, we can see the current CNSA president, Tiffany, attending a rally with the CFNU during their advocacy in Nova Scotia during the premier's meeting that happened over the summer. In the bottom right corner, we can see a photo taken from the ICN Congress that Dr. Chapman mentioned, where there are a few board members of the CNSA alongside the then Minister of Health, Minister Duclos, during the ICN Congress. There's also an image that depicts various members of the CNA board, along with myself, with the new Minister of Health, Minister Holland, in Ottawa last fall. And finally, the latter two images on the left-hand side are images taken from a conference we held in Edmonton earlier this year that garnered about 300 students from different parts of the country. So all this just kind of is to give you an idea of the different activities and projects the CNSA does. And if we can move to the next slide, I will just briefly highlight some things to look forward to from the CNSA side of things. This includes a national survey of nursing students that we are undertaking in collaboration with the Canadian Federation of Nurses Unions to better understand the experiences of nursing students going through their education, with a particular focus on understanding the financial stressors and challenges they face. More information will be circulated to deans and program heads, as well as local nursing student societies, and a formal launch should occur on our websites, hopefully later this month. Other dates to look out for is a National Nursing Students Week we facilitate in late November of each year, where we host different webinars and online activities, and as well as various giveaways. A national conference which will be held in Halifax next year in late January, and finally a scholarship application period, which would be opening on the 1st of January next year. So that's a little bit about the CNSA, and I will now pass it off to Dawn to speak to CASN.
Welcome. I'm coming in from Treaty 6 and also Region 4 of the Métis Nation of Alberta. So CASN is the national voice for nursing education, research, and scholarship, and represents the baccalaureate and graduate nursing programs in Canada. Our mission is to lead nursing education and scholarship in the interest of healthier Canadians, and we're a volunteer organization that represents 95 member schools, from across Canada, across Canada. Next slide, please. So what we stand for, we stand up for quality nursing education, lead standards of excellence, a national voice for educators in school. So just expanding on that a little bit, we speak for Canadian nursing education scholarship. We establish national standards of excellence for nursing education, such as nursing guidelines, entry to practice competence of various topics. We promote the advancement of nursing knowledge, facilitate the integration of theory, research, and practice, contribute to public policy. We collaborate with the CNA, for example, and with Lee on various things to further policy. And we also, just provide a national forum for discussion of nursing issues, such as today. We have webinars, various topics. We have undergraduate, graduate forums speaking to various topics of interest to the nurse educators. And next slide, and I'll turn it over to Lee.
Okay, thank you. Sorry, I just saw a comment around the view that folks couldn't see the slides. So in terms of the presentation today, certainly we want to do a bit of a deep dive into the toolkit, but also direct you to the Canada.ca website, where you'll actually find the toolkit in both official languages and be able to download it and use it in nursing education in various ways. I think that it's, since my appointment, there's been calls for sort of a national nursing health workforce strategy, and really the retention toolkit is that de facto pan-Canadian strategy. It does provide a glimpse of what nurses want and currently need, and I think it will be helpful when educators are interacting with employers and healthcare agencies, as well as brokering those relationships between academic settings and health service delivery settings. Certainly in discussions with students, I think there's some really crunchy policy bits of information in the toolkit and recommendations in terms of best practices that are highlighted in the toolkit. I think there's also an opportunity to plan educational activities using some of the toolkit's themes and goals, to use it in various types of curricular activities and so on. And I also think that, educators are exceptionally well poised because you are really linking the service side of healthcare with the preparation of future nurses. And so I think using the toolkit as perhaps a framework for advocacy or representation at local, provincial, or national committees. And these may be within your institutions or beyond. So I think lots of opportunity. And I will just say that, coming together, CNSA, CASN, and myself, my role involves collaboration. And I think that it is really through these sort of fruitful collaborative opportunities that we're actually able to come together and talk about strategically what is important to nurses. And that was really the impetus for today, but certainly a great impetus for the toolkit development itself. Okay, so we'll go to the next slide, please. So in terms of our nursing workforce, the CIHI data, this is from 2021. I know CIHI is working on a new minimum data standard to try to get a better data capture. This is the most recent iteration of data. And I will just say that although nursing is the largest group of regulated health professionals in Canada, it's really important to also look at the entire picture. We know that we all operate within an interprofessional context. And I think it's important to think about the nursing role across these 4 categories of nursing Canada, not by the fact that we are so numerous, and that's why perhaps policymakers should pay attention to us, but actually because of the role we play, because we have such a broad, holistic orientation to practice, because we often do a lot of systems navigation, and because of our role, by virtue of our role being most proximal to the point of care, it's really important to consider nursing as the largest group of regulated health professionals, but also as key players when it comes to our health systems across the country. Of course, we know there's many different areas of specialization. There's many different contexts of practice. There's the 4 categories of nurse. We have 2 official languages in Canada, but we all come together under the umbrella of nursing. And certainly this is a really important point, because when I'm representing nurses in Canada and internationally, it is all nurses from coast to coast to coast across these 4 categories. So really thinking about what unites us across the country. And I know, when we talk about regulated health professionals, this is probably no news to all of you that we're talking about a legislated scope of practice, which is often a bit different than the roles. We talk about scope in the work context, but often there's quite a significant difference between a legislated scope and an organizational role that is articulated through a job description, as well as various standards in the work environment. Health professionals also have a protected title, a mandatory educational requirement, and professional standards for practice. And this is all done at the provincial and territorial level through various regulations and legislation. So we'll go to the next slide, please. In terms of the impetus for the Nursing Retention Toolkit, very early in my tenure, I really committed to engaging with nurses across the country. And it was very clear that there was a lot of work being done on recruitment, a lot of recruitment incentives at the organizational level or at the jurisdictional level, and much less being done on retention. And in fact, nurses would say to me, "What about me? I've been practicing for this many years, and there's really not a lot of focus on me in the work environment, on the mid-career nurses, even on nurses transitioning to practice who had just completed their nursing education over the course of the pandemic." So this was really the driver for developing the Nursing Retention Toolkit. As Yasu mentioned, I brought together an advisory committee, and CASN and CNSA were part of that advisory committee, as well as CNA, the Canadian Indigenous Nurses Association, Canadian Black Nurses Alliance, and so on. And together we co-developed these 8 core themes that impact a nurse's day-to-day working life, primarily in the domain of clinical care, and then subsequently developed corresponding tools that Canadian employers and health authorities can implement. And this is a really important point, that the recommendations in the toolkit are really aimed at the organizational or health authority level. They are structural changes that are needed in terms of how we are valuing the nursing workforce in Canada. And that's why we really went with this subtitle of Improving the Working Lives of Nurses in Canada, because that is essentially the goal. And I would say that, when we went into the Nursing Retention Forum in June, we really had just loosely developed these 8 themes that you see in the outermost wheel. And it was really up to the participants in the forum from every jurisdiction in Canada to co-develop the initiatives, as well as the resources and examples. You can see these 8 color-coded themes are underpinned by the values of respect, anti-racism, anti-oppression, transparency, and accountability in the innermost circle. And although the toolkit itself was created in the context of interdisciplinary team-based care, it certainly had a very strong spirit of being an initiative that was by and for nurses. And I think you'll see that come out very clearly in the toolkit. I will just say that nursing doesn't own retention challenges. These are challenges that certainly persist across many other health professions. And I think there are concepts that are generalizable, but the spirit of the toolkit was very much created as a uni-professional initiative in this interprofessional context. So we'll go to the next slide, please. So this is really just to give you a sense of the 8 themes. Again, you see color-coded down the one side of the slide, then you'll see there's a goal statement for each of the 8 themes. And then all of the themes have 3 initiatives after each of them, with the exception of safe staffing practices, which just has 2. And we're going to be going into this in a lot more detail, but I will just direct you to the Canada.ca website, to the full toolkit itself, because I think what you'll see in the slides that follow are that there's all kinds of references, resources and examples. So we really tried to highlight where these things were already occurring across the country as a means of showing that we're already doing a lot of really great pro-retention initiatives in Canada. And these are ideas that can be scaled and spread. So we'll go to the next slide, please. Perfect. So here we have inspired leadership, and I was going to say the first theme, but again, we depicted the themes in the circular format and the circular depiction to not show any rank or order to any particular theme over another. We think that they're iterative, and organizations can sort of pick and choose and decide what's more important to them. It doesn't have to be exhaustive in terms of how they're implementing the themes of the toolkit. So here, under the theme of inspired leadership, the goal is to empower nurses of all levels, roles, and settings to experience fulfillment in their work. There's lots of talk now about joy in work, and really thinking about how we can foster that as leaders. Leaders at all level. Leadership is really about how we show up every day, not necessarily around a role or title, but we want all nurses to become leaders in some way in their organization. And I know I will defer to Dawn to talk about the specific initiative of leadership competencies and the CASN National Nursing Education Framework.
Great, thank you. Yeah, so the framework, as you can see, it's a national consensus document. It's provides guiding principles and learning outcomes to assist nursing programs, whether they're developing a program or revising their program. These frameworks are revised every 5 years. To ensure that they remain current. And one of the domains, there are 6 domains. One of the domains is leadership, and I thought I would just, there's a guiding principle for each level of education. So I thought I would just let you know what the guiding principle is for each level. So for the baccalaureate level, the nursing education program prepares graduates to coordinate, to affect change, and to lead within the context of providing nursing care. So that's at the very sort of at the basic level. In the master's level, we have that the nursing education program prepares graduates to provide accountable leadership and oversight. So you can sort of see where it's a little bit higher level activities. And then at the doctoral level, we have the nursing education program prepares graduates to lead complex local, provincial, territorial, and national healthcare initiatives, programs, and or research teams. So again, you can see where that's even at a higher level.
Great, thank you so much, Dawn. I will just mention that the examples that you see here under, for example, emerging nursing leaders, we've highlighted the UNB certificate in nursing leadership and management. We know there's lots of schools offering these types of professional development programs to inspire nursing leadership. And really hope to just capture several examples from across the country when we were producing and developing the toolkit, but it's not an exhaustive list, really just to highlight a few examples. So we'll go to the next slide, please. Okay, so the next theme, organizational mental health and wellness supports. This is certainly getting a lot of attention when we talk about the need to actually have a resilient health system comprised of folks who actually feel supported in the work environment, and ensure that we actually have appropriate and effective preventative acute health and wellness supports, as well as mental health supports. I think this was something that we heard, loud and clear from health workers during the pandemic, that they felt that they had acute needs and needed supports that were not available at the time. So maybe before deferring to my colleagues from CASN and CNSA, I will just mention the example provided here under moral distress and injury care. I think it's kind of a unique example because many organizations have EAP programs and EAP supports. I think what was unique about Health PEI as a provincial health authority is they actually enlisted the support of a third party. And often what we hear from nurses is that there's a reluctance to actually engage in organizational EAP for fear of some kind of penalty or oversight or surveillance from the employer. So this was actually a means of engaging EAP supports through third-party mental health supports, and the uptake was actually higher than in-house EAP support. So a great example of providing sort of bespoke supports and mental health supports to employees. And I will perhaps turn to Dawn to talk about the example under zero tolerance for violence, bullying, and racism.
Thank you. Yeah, so in 2023, CASN led the development of a national consensus document entitled Promoting Anti-Racism and Nursing Education in Canada. And it's not good enough to be not racist. You have to actually promote being anti-racist. So that title was specifically chosen to be anti-racist. Now, the document, describes nursing students and faculty members' experience of racism, and it includes 5 action steps to address racism in curriculum. I'll just quickly read them off. There's making racism visible, embracing inclusion and equality, optimizing student success, building anti-racism and allyship, and then addressing racism in their curriculum. And again, referring to the retention theme of today, being anti-racist is one in nursing education is one strategy for retaining and for retaining nurses and nurse educators. And just finally, we're just currently working on a survey to deans and directors of nurse educators about their experiences of racism, with the goal of developing some kind of a resource for nurse educators in Canada.
That's great.
And,
go ahead, Yatu. Yeah.
If I could just add on to the importance of addressing like zero tolerance for violence, bullying, and specifically racism within nursing education. It is often that certain incidents in a clinical setting and also outside of a clinical setting between students and instructors, or students and staff may result in like experiences of racism or like marginalization by specific students. So it's very relevant and very important to factor this into the policies and procedures of various nursing educational institutions to help prevent students from feeling like they have nowhere left to turn to and perhaps being unable to complete their program to the finish, more or less. Because as it currently stands, there are various gaps that can be like identified with big power imbalances between students who are at the receiving end of experiences of bullying or racism and maybe the perpetrators of these actions. So reflecting on the report published by CASN around how to go about best promoting anti-racism in nursing education is of great importance there. So I just wanted to speak to that. And I also wanted to speak to the initiative of best practices for vacations and time off, in showing the example of the uni program that takes place in Alberta, in which students in between their 3rd and 4th year of nursing studies have the opportunity to be employed by the Health Authority, Alberta Health Services, to work as employees during the summer months and provide very extensive vacation relief, which not only grants nurses the opportunity to actually take their vacation days and get the adequate rest they need to prevent burnout and improve their mental well-being in the long term, it also equips students with very valuable experience in that summer months that they can then translate over to their final preceptorship or consolidation placements when they move into the 4th year. In my experience, the vast majority of my classmates had the opportunity to participate in this initiative and become an undergraduate nurse employee, and the feedback was overwhelmingly positive. And although the availability of these positions vary from province to province, and they often fall under different names, such as employed student nurse programs, extern programs, I think as it is called in Ontario. They are a very, very good example of how engaging students in the process of addressing the crisis in like the nursing staffing, it can go a long way. So you will see that undergraduate nurse employees and like equivalents are going to be brought up at several points in this presentation, and this just speaks to the relevance and usefulness of engaging nursing students. So I'll go on to the next slide now.
Great, thanks so much, Iyasu. I think it's a great resource for optimizing time off and also student experience. It's very mutually beneficial. Okay, so professional development and mentorship is another theme in the toolkit. And really, this is about providing nurses across the entire career span options to enhance their skills and pursue their career goals. I know this is something we often talk about in nursing education. I always sort of giggle when students will say to me, I'm so excited to be finished my nursing education program because I won't have to reflect anymore. And of course, it's clear that reflection is inherently part of our practice, as is professional development and lifelong learning. We may not just be handing in the reflections for grading or for grades, but of course, that's inherently part of our practice. However, I will say that in speaking with organizational leaders across the country, there is very little there are very few resources for professional development and mentorship. And in fact, many organizations are having to think very creatively about utilizing philanthropic dollars or private investors to actually support professional development and mentorship. So there's some examples that we've provided here that I think are diverse examples of mentorship programs that can occur. And again, not exhaustive, but just a couple of examples from a few different jurisdictions. So Ontario's Clinical Scholar Program was a means of pairing experienced nurses as a mentor with newly graduated nurses and IENs, as well as with nurses wanting to upskill. I know this was a massive investment on the part of the province, but it's been really wonderful to meet with nurses who have either been clinical scholars across the province or who have benefited from the clinical scholarship program. So a great example of a provincial initiative and support of mentorship. We also highlight the UBC mentorship program, again, and several schools do this, I know, across the country, but this is but one example where senior nursing students are connected with alumni as a means of supporting that transition to the workforce. We also highlight the Ottawa Hospital's Clinical Coach Initiative. And this was something that the Ottawa Hospital took upon itself because they really wanted to provide a means of providing that point of care or at the elbow support to new nurses, particularly in the times when educators are not available or on evenings and weekends, or if the educators are busy with other initiatives. And they provided coaching sessions to late career nurses. And really, it was about non-technical skills. It was really about that coaching and mentoring relationship. And engaging with nurses who have participated in this program, both the nurses who have benefited from the clinical coaches and the nurses who have been the clinical coaches themselves. They have found it to be, the most rewarding part of their career. They don't always have the answers, those who are the clinical coaches, but they certainly have that resourcefulness, and they're able to support that learning and that at the elbow support. I know St. Paul's Hospital is doing this as well in Vancouver, and there's likely other examples across the country, but great examples of mentorship. Next slide, please. Okay, so I'll turn it over to Dawn here.
Sure. We're going to talk about the mentorship program. So I just wanted to, the intended outcome, retention of nurses and longevity of nursing careers are promoted within professional. Nurses are supported to help define their own development path over their careers, and just so for safe and effective care. Now, here's a quote from Cynthia. CASN is strongly advocating for formalized system of transition support, including residency programs for entry to practice nurses and mentorship programs for IENs. And we believe the inclusion of professional development of nurses in this toolkit will have a significant impact on the quality of nursing care in our healthcare system and on the retention of nurses. Next slide. So the first thing I'll talk about is the CASA Nurse Residency Program. It's a 5-year Health Canada funded project, and it's in partnership with employers. So it's not with individual nurses. The partnership is with individual nurses, it's with employers. And there are 2 main parts to it. There's preceptor mentor training for experienced nurses. It takes about 10 to 15 hours in total, but it's offered over a 3-month period. There are 9 asynchronous modules. There's an hour facilitated discussion, then a very short assignment, which is about, based on what you've learned in the modules and discussion, what's the first day look like with your new nurse? So it's a very practical sort of assignment. And they're assigned to new graduate for 6 months. And again, the hospitals or the healthcare agencies determine who these people will be. CASM does not determine that. Next slide. So the preceptor mentor training was the first part. Then the second part is this nurse residency program. This is for the new grads, or the newly licensed registered nurses. There are 6 day-long virtual synchronous workshops, and examples of topics are stages of transition, conflict management, time management, research utilization, those sorts of things. And then there's also, it's not on that slide, there's also 4 online simulations that they do, and then they're assigned to a preceptor mentor for 6 months, and then so it kind of helping them the first 3 months, kind of more shoulder to shoulder, elbow to elbow, and then the last 3 months is a little bit more we actually more mentoring. So we call it a preceptor mentor on purpose, in the sense that the first 3 months are more preceptoring, and the last 3 months are more mentoring. And if you have wants any information, please feel free to connect with me. The next slide, please. Oh, sorry. I meant, yes, so as well as the residency program, Health Canada has also funded 2 research projects. Transition to RN, led by Judy Dukeshire, whose name popped up earlier. So hi, Judy. And then there's also an economic evaluation led by a health economist out of the U of A. So the idea is that we'll get some Canadian-based data. There's data from other countries, but not much Canadian-based data. So this is, we'll get some good data from this project. Next slide. So then the second one, the program is the IEN mentorship program. This is a shorter program, a 1.5 years, but it's Health Canada funded project with them, partnership with employers. So it's very, the model is very similar to the nurse residency program. It's shorter, however. So there's mentor training for experienced nurses. The 3 asynchronous modules. There's communication, teaching, learning theories, the IEN experience, conflict management, providing feedback. So these are things that this is what the mentors will need to know. Again, there's 1 hour facilitated discussion, and then they're assigned to an IEN for 3 months. So this is the first step. Next slide. And the second step, again, is the IEN residence. So this is for the new IENs. Now these IENs they're employed already, so they're licensed. They're not coming. This isn't a program to become licensed in Canada, but they are already licensed and employed as an RN. And there are 3 virtual synchronous workshops: transition to the Canadian system, developing resilience, applying best practices, collaborating with healthcare professionals. So these are examples of topics. And then these IENs are assigned to an experienced nurse for 3 months. And you can contact me or Leah, or you go to our website if you want more information about that. Next slide. I'll turn it over to Lee.
Okay, thanks so much. I just want to highlight that you mentioned the fantastic work of Dr. Judy Ducher, and if I think this is an excellent resource. The book From Surviving to Thriving, really about that essential transition support in professional nursing practice, especially and that first year, which is critical. And really, I just want to pause and say this is why we included CASN and CNSA in the development of the Nursing Retention Toolkit, because we know that retention actually starts in nursing education programs, that there is attrition. And when the service side of health care delivery is strained, so too is the education side. And so there's challenges all around. And I think that we all need to find the resources and find the opportunities for collaboration and supporting transition. So again, a couple of examples here. I know that Dawn has just mentioned the National Nursing Residency Program. There's also an example in Manitoba, the Shared Health Clinical Transition Program, which essentially pairs an experienced nurse, students with an experienced nurse in the department to act as a mentor and help guide them through to graduation. I know this is really, really challenging in the context of shortages. When there's vacancies, it's really hard to have learners who are supernumeraries. So having these types of dedicated programs is a means of really bolstering that support and easing that transition to practice. And then again, the McGill University Health Center's Genesis Nurse Residency Program is another example of transition programs. We'll go to the next slide, please. There's lots more resources and examples in the toolkit as well. And I'll turn it to Yasu for this slide.
Yeah, so in the toolkit, I kind of go into maybe some context as for the importance of formal transition programs to support new grads making that transition into the profession, as there is a lot of precarity and attrition that occurs between like the end of nursing education and like the eventual transition into a stable like mid-career nurse. And having these initiatives such as the National Nursing Residency Strategy, the CASN National Nursing Residency Program, as Dawn explored, can help combat this. As new grads, we often have to juggle between the precarity of completing your university education, studying for the NCLEX, applying for jobs, and all of the mounting costs of applying for their licensure and paying for all the prep for the board exams. So this can be a very tumultuous and stressful period. And depending on like how they felt by the end of their final clinical placements, it can make for a very like stressful time that's marked with a lot of change. So having these opportunities for new graduates to function more on a supernumerary basis and be paired with experienced nurses goes a very long way in helping cut back this attrition and ensuring they are retained in a very pivotal part of their career to ensure that they, as I said in the quote, have a long and fruitful career in nursing. So that was the intended outcome of this initiative. We can move on to the next slide.
Great. So here are some examples under career pathways and bridging programs, and we're really just going through all of the initiatives here because I think it's germane to this discussion and certainly the focus on education. So again, there's three examples under career pathways and bridging programs. New Brunswick's Step Up to Nursing initiative, as a means of bridging, it's kind of the learn as you earn opportunities, providing salary and tuition support for PSWs to bridge to LPNs, or for LPNs to bridge to RNs. I will just say that this is but one example, but I know this is very, very popular across the country, these types of scaffolded learning opportunities, bridging from either one other health profession to another or one category of nurse to another. Vancouver Community College has an advanced entry program. This is, again, just another example, and a support for bridging programs in Manitoba, where nurses can be supported. This is enshrined in the collective agreement for taking an LOA for bridging programs or pursuing education positions. And I will just say under bridging programs, we really try to focus on all nurses. And really, you'll see that there are other resources and examples for internationally educated nurses. We often think about expediting the entry to the profession for internationally educated nurses, and it sometimes stops there. We actually need to be thinking broadly about leveraging the vast expertise that they bring from a global context, because this is really a benefit to us in Canada. So thinking about how we can include IENs in some of these career pathways and bridging opportunities. Next slide, please. Okay, reduced admin burden. This topic, I would say in general, is getting a lot of traction. It's getting a lot of attention. It's a major piece of advocacy for the Canadian Medical Association. I know the Nurse Practitioners Association of Canada is also very interested in this topic. When we talk about it in the toolkit, it's really a means of freeing up nurses to focus on the essential and core aspects of care, what nurses are uniquely skilled to provide. As I'm sure you can all attest, we spend an awful lot of time and energy educating nursing students, and when they enter the work environment, there's many things that they are doing that are occupying an awful lot of their time that perhaps other providers could do. When we talk about work redesign, it's really identifying opportunities to free up nurses to focus on professional nursing practice. I know you're all thinking, how on earth is this possible in the context of the shortages that we're facing? And really, that's why it's such an important retention initiative, because unless we're actually thinking differently about the work environment, we will not be able to retain nurses in this current context. And this is in the context of a global shortage as well. We know that when we do redesign the work environment, we're improving the mental health of nurses, decreasing workload or burden, and increasing job satisfaction. We are optimizing the scope of nurses, allowing them to focus on nursing-specific tasks and patient care, delegating non-nursing tasks to dedicated support staff, increasing patient satisfaction as well, due to enhanced nursing-focused care. Another example that we provided is the extern example, but it's we're leveraging the opportunity to have nursing students work part-time and support interprofessional teams in the clinical environment. Often when we think about work redesign, it's not necessarily about having more nurses. In fact, often it's not. It's about actually bringing in and leveraging the expertise of diverse providers. And so the extern is one example. Again, lots of organizations across the country have externs. This is but one example. And we'll go to the next slide, please. Okay, so here you see all three of the initiatives. You see work redesign, digital preparedness. We've highlighted some tools from CNA and CNIO, really about having chief nurse information officers, ensuring that we have that nursing lens to digital preparedness and decision support tools. And then documentation requirements is another example. We've highlighted the English Health Authority in New Brunswick, Horizon Health's Forms Committee. This is really a means of streamlining forms. Often we are very documentation heavy in healthcare, very risk averse sector or industry. And so thinking about how we can actually streamline processes, ensuring that we are not creating an excessive burden on providers, that organizational requirements aren't exceeding regulatory requirements. Next slide, please. Okay, this is I want to say the last theme, but again, if you think of the themes in that circular depiction, it really is iterative. This is the one theme that just has two initiatives after it. When we talk about safe staffing practices, again, this is something that's getting a lot of attention across the country. It really is about supporting physically safe and psychologically brave workplaces by implementing staffing practices that reflect factors like patient acuity, nurse experience, and work-life balance. And I really stress that this is ultimately something that is about protecting providers and protecting patients. And that is really the impetus for this theme on safe staffing practices. So we've highlighted the CASN National Nursing Residency Program, which you've heard about, and perhaps I will defer to Yasu to talk about the Black Nurses and Students Allied for Success Undergraduate Mentorship Program, as well as the uni program from Manitoba.
Yes, for sure. This initiative, the Black Nurses and Students Allied for Success Undergraduate Mentorship Program, is something that was organized by the Canadian Black Nurses Alliance that ensured that students studying in nursing who identify as Black can get some mentorship and support from more senior professionals and mentors that would aid in their completion of the program and thus help with the massive gap we have of diverse professionals in healthcare. As Dr. Chapman mentioned, not only does like safe staffing practices just refer to maybe the total number of like qualified health professionals available to deliver care, but also other factors such as there being like culturally safe care delivered. And this ties into ensuring there is diversity in the future nursing workforce. And this in turn is why there is a connection with the mentorship program for Black nurses and students allied for success that is listed in this slide. Additionally, there's also reference to another uni initiative, this one coming out of Manitoba. And this, of course, ties into the topic of safe staffing, as in addition to helping relieve perhaps summer vacation vacancies that are created, that was mentioned earlier in the presentation, like how in Alberta there's mass hiring of nursing students to support these gaps. Also recruiting unis to fill vacancies and like staff shortages whenever that they are applicable on a part-time basis, even throughout the school year, goes a long way in dealing with the safe staffing goals we have in healthcare, because there is a strong case to say that by the time a student is has completed their first 3 years of their education, they have many of the skills and competencies necessary to work in many hospital settings and take care of some of the responsibilities that aren't fully being met due to the constraints many units across Canada are facing due to the staffing crisis. So this is just the final example of how the integration of students as a method to support the retention of nurses can play out. We started the presentation by talking about how students can support vacation and like time off best practices. And we also spoke to how students can help with the administrative burden, reduce the administrative burden faced by nurses by, again, being yet another set of qualified healthcare workers that can lend a helping hand. And there's also the dimension of safe staffing being supported through the usage of nursing students as unis, externs, employed student nurses, or whatever regional variety your specific province describes them by. So with that, I will turn to the next slide and return it to Dr. Chapman.
Thanks so much. Yeah, so I think you've really nicely highlighted how this is really a win-win situation when we're able to engage students and provide them with that key learning during their nursing education program as a means of supporting staffing as well, and not as a means of exploiting students through employment, but actually providing opportunity and ensuring that that readiness to practice is addressed during their nursing education program. So I think you've heard as well already about the CASN National Nursing Residency Program, and we also highlight here the CNA CFNU Evidence-Based Nurse Staffing, Safe Nurse Staffing Toolkit that really does focus on patient needs, nursing workload, as well as other concerns. I would say this is a really hot topic across the country. We know that BC has implemented, the BC government has implemented nurse-patient ratios. This is in collaboration with the BC Nurses Union, sorry, and also Nova Scotia Nurses Union also recently negotiated a safe staffing framework in their jurisdiction. But there's lots of interest in this across the country, and I think it's really important to center this around what's best for patients and what's best for providers. So lots of attention on this topic, I would say, and more to come. And we'll go to the next slide, please. Perfect. So that actually brings us to the end where we are happy to entertain questions. I will just again stress, the great diversity that we have in this country, 10 provinces, 3 territories, 2 official languages, 4 categories of nurse, many different areas of specialization, all kinds of different models of nursing education across the country. But collaboration is essential. It's key. And I really am so grateful for the opportunity to work with all of you from coast to coast to coast. I welcome the feedback, the critical questions, and I think that together with CNSA and CASN, we are all charged with uplifting the profession despite the current challenges that are before us. So thank you very much. Merci beaucoup. And I'll turn it over to Christine for questions.
Okay, so before we dive into questions, I just wanted to thank you, Lee, Don, and Yasu for such a wonderful, thoughtful presentation. We do have a number of questions in the queue, but I'd invite folks, if you want to submit a question in the Q&A function at the bottom of the Zoom window, to feel free to do so, and we'll tackle as many of those questions as we can. So we did have a couple of questions related to the employment for student nurses in the context of supporting vacation and time off. So I'm just wondering, there's a couple of questions. Could you speak to the scope of students in such programs? And a similar question, a participant has a program that's similar to the unis in their province and noted that students are able to request extensions and additional hours under that program. So how can you develop a program thoughtfully and build a culture that doesn't take advantage of nursing students or risk burning them out?
I think I could speak to these questions. So the scope of these students usually involves everything they've learned up until that point in their studies. So like the basic nursing care, administration of medications, dressing changes, things that would fall within the scope of a student who has completed up until or maybe midway through their 3rd year of studies, as well as there might be some variation depending on the specific site they're at and the policies of the hospital or unit that they are placed. But it would assist in staffing by, at the very least, just downloading some tasks onto the student that could then free up the registered nurse or licensed practical nurse to take care of things that perhaps can't be done by anyone else. Kind of tying back with the theme that Dr. Chapman mentioned of allowing nurses to fulfill like the tasks that only they can perform in the hospital setting. So that would be my response to Candace's question. And with regards to the other question of how to ensure students are well taken care of and not burnt out, while also working as employed student nurses and making money, I do think there is like a fine boundary that has to be set by individual students about how they want to balance their life responsibilities while also pursuing these employment opportunities. One thing I would say is that the availability of financial supports to students is one maybe like mechanism that will prevent students from burning themselves out. As a common reason for maybe students burning themselves out and working excessively as either healthcare aides, unis, employed student nurses is due to financial pressures they face, which are very legitimate. However, they maybe just have no choice but to work excessively. So through some new initiatives that we are actually seeing in the past year, such as the BC government announcing nursing students can be entitled to up to $2,000 in tuition grants, $5,000 if they are an Indigenous nursing student. Financial support structures like that can hopefully allow students to complete their program with less financial stress and hopefully not find it necessary or compelling to burn themselves out before they graduate. So I hope that answers your question. And if you have a follow-up, do just post that into the chat.
Okay, I will move on to the next question. It is regarding a clinical nurse mentors program that has recently started up in British Columbia. They're in their evaluation phase and thinking about what metrics should be used to help in evaluating that program. Given that many places are still struggling with staffing shortages, it might not be an instantaneous fix to that issue. So what lens could be used to show success of something like a mentorship program?
It's a great question. I'm happy to start, but certainly also welcome input from my colleagues. And I will just perhaps start with an example that I heard just yesterday of a manager who had used the toolkit to guide her approach to staffing. And this was about staffing in particular, but again, using the toolkit as a framework. And it was part of a group that was actually the worst performing group on voluntary turnover, and using some of the examples and initiatives in the toolkit actually improved voluntary turnover by 8%, which I know seems really small, but those incremental changes are really significant. And so I think that, again, not to sound repetitive, but really guiding you to some of the resources in the toolkit, because I think you'll get some of those metrics, beyond staff satisfaction and things like that. I think that, it's very clear that we have a really dedicated workforce. Often we have nurses who are driving past several facilities to get to their chosen facility, their chosen place of employment. So thinking about what are the things that are keeping them, what are the things they're looking for. We've seen an exodus out of the public sector into staffing agencies. And so thinking about how we can offer some of the things that nurses want and need. And, I will say that this is longitudinal. These are incremental changes. I think what's key is finding the opportunities for quick wins. I will say that we included a whole gamut of resources in the toolkit, even things like daycare for shift workers, housing supports, transit subsidies, parking subsidies, things that other industries have really figured out, but they're really difficult, I think, in healthcare. We haven't thought about these things in healthcare as much as we perhaps should, and it's showing in terms of our retention in the workforce. So, thinking creatively, I would suggest that staff may have ideas about what to measure and how to measure things as well. So, engaging staff through participatory governance opportunities may be helpful as well. Certainly, defer to Yasu or Dawn as well.
I was going to say that just what you were saying now about asking staff, and just the other thing, instead of maybe some kind of, you were mentioning not beyond staff sort of satisfaction surveys, but maybe there be other things to measure than satisfaction. There may be mentals, I don't know what, but just thinking broadly about what you could be measuring. Yeah, that's all I was going to say.
Yeah, so did you want to add before we move to the next question, or?
No, I was ready to move to the next question.
Okay, wonderful. So the next question is around reducing administrative burden. and leveraging technology in clinical settings? This is a tough question, and I feel like we've been talking about it for a long time. But thinking about within a health authority, platforms not talking to other systems, which causes an extra burden on the nursing workload. Are there talks on a federal level to have a unified healthcare platform or ways to leverage technology to make these things easier? And the participant noted, with COVID vaccination clinics, some of those issues were resolved.
Yeah, it's a great question, and actually it's such a timely question, because I think when we think about all the innovation that happened in COVID and the breaking down of silos, I worry often, this is sort of what keeps me up at night, that we have often returned to sort of status quo of healthcare. Many things have returned, and we've kind of gone back into our way of doing things. And in fact, we need to lean more and more into the innovation as much as possible. So I've just put actually in the chat, just in June, Minister Holland announced the Connected Care for Canadians Act, which was essentially about that. It was about the interoperability between systems. This is always a perennial problem. You could have, for example, two hospitals across the street from one another, both using a particular type of information management, and they don't talk to one another. And I think, we need to really think about that. So that was the impetus for this bill. So it's a really timely question, and I would just direct you to that announcement, because I think that it answers your question and the concerns that you raised.
Wonderful, thanks, Lee. And next, I'm going to turn to a question about critical care environments. Prior, there used to be requirements to have previous ward experience. And now there are novice nurses joining critical care units, and they face anxiety, burnout, and have feelings of being alone. So how can we support these novice nurses in these settings? Yeah, Sue, maybe you can speak to that.
Yes, I think this ties well into the initiative of transition programs and stronger development supports and mentorship for these students interested in pursuing critical care environments. As you are right, there is a lot of interest and uptake of students wanting to be placed and eventually working in critical care, right out of graduation, which is of course welcome, as there is a very acute shortage of staff in those environments. But we also have to make sure that there is sufficient training and supports in place. One initiative I can just actually think off the top of my head is there is the STEEP program. I can perhaps link it into the chat. But in Alberta, there is an opportunity for students to work as a uni in critical care, then complete their preceptorship, and then do a kind of coordinated transition residency, all within critical care, to help bridge that gap and make that transition a lot more smooth as for students who want to go into critical care environments. So yeah, I think the response would just be making sure there's sufficient supports in place for these students.
Thanks, Yasu. And Don or Lee, did you want to build on what Yasu was saying there?
No, I don't think so.
Maybe just to mention that this is not necessarily a new phenomenon. I have been a nurse for just over 21 years and went directly into critical care, but was very, very well supported through a robust orientation program, as well as lots of buddy shifts, employer funded ACLS and so on, and really kind of a bridge to when I was fully functioning independent as a nurse. And so I felt very safe in that context. And I think we also need to remember that students have had really robust, hopefully, nursing student placements throughout their education. And so it's not as though they're coming in, de novo with no actual practice experience. That we have provided those learning opportunities throughout their nursing education program. And that provides a richness, I think, of experience as well.
Wonderful, thank you. And then the next question is quick. Folks are really curious about the unis. So would students require registration with their provincial regulatory body? Yeah, so do you have some more information on this?
I can't speak to the situation in every province, as I imagine the specifics might be a little different. I do know students would automatically become members of their provincial nurses union by virtue of taking on a job as uni or employed student nurse. But as for like if they need to procure like registration with their regulator and if they need to then get additional insurance, that is a bit unclear to me. So I think you might have to potentially contact either the college of the province that you're part of, or maybe the nurses union, and they could provide more insights.
Okay, thank you. And then another question related to that, students covering vacation if they haven't completed their studies and are not equivalent to the nurse they are covering. Would this be a total replacement, or would the unit be short the individual on vacation and the student is just providing support in another role? I don't know if that's maybe too in depth, but if anyone wants to comment on that question.
I don't know, Dr. Chapman, if you wanted to speak to this.
Sure, I'm happy to. And I think that it's perhaps it's misleading that it's not a one-for-one. You know, if a nurse goes off on vacation, it's just that we know, I think when we were developing the toolkit, it was very clear that nurses in some organizations hadn't taken vacation in years because of shortage. The other phenomenon that happens is sometimes we're our own worst enemies in nursing, and we actually take a payout in lieu of vacation. And so the retention toolkit really does focus on the need for nurses to have rest and to have vacation and dedicated time off. So the students are really, it's really the latter is correct, that the student provides additional support. Certainly the unit would potentially be short, and I would hazard a guess that many units are perpetually short every single day. So this is really a means of providing additional supports, additional clinical supports, and even administrative supports in the unit to ensure that we are optimizing best practices when it comes to vacation and time off, because that really is pro-retention, right? And I think that's the win-win of these examples, that we're providing, leveraging students' opportunities and learning in that clinical context, but also supporting nurses to be able to have dedicated time off.
I'm also just seeing in the chat some folks making connections around some of the stuff that you've been talking about, Lee, so that's great. Maybe I'll just ask a question. I'm not seeing any other new questions in our, oh, actually we just got one. Do you have any recommendations on how organizations can support IEN transition to practice besides the unit mentorship and support?
Yeah, it's a great example. It's a great question, because I think that again, we're so seized with that integration into the workforce, and need to actually ensure that there are additional supports. So there's some organizations that are really doing this well. I know the jurisdictions that have SPEP, supervised practice experience programs, are really popular as a means of transitioning to practice. I think that there's also buddying opportunities that I've heard about. I know that the organizations that are doing an exceptional job in supporting IEN transition to practice are organizations like N4, even WES and Care for Nurses. And so I would defer to their expertise, because I think there's lots of variety, but I guess suffice to say that we can't forget about IENs when we're thinking about all the supports needed in the practice environment. And I think we just like we spend an awful lot of time in the practice environment sort of seized with what nursing students don't know and new graduates don't know, instead of actually thinking about all the gifts that they bring and how they enrich our practice environment. And so too is the same for IENs. We actually need to embrace the diversity of our nursing workforce, ensure that it reflects the diversity of people in Canada. And so we actually need to ensure that we have IENs as leaders in organizations across the country, that we're leveraging the rich experiences that they bring from their country of origin.
That's wonderful. Thank you. Maybe I'll just ask at this stage for a couple of maybe key takeaway messages. If you're maybe thinking from the perspective of a nurse educator who's just getting familiar with the toolkit, what would you suggest as kind of the key takeaways, or perhaps low-hanging fruit where folks might want to focus their attention and efforts on if they're feeling a bit overwhelmed by all the information there?
I'm happy to start and jump in. I mean, I would say engage nurses, engage nursing students, engage nursing practice councils, professional practice councils, as a means of sort of seeing what are we doing well in this organization or in this context. And I think that will very quickly identify the sort of low-hanging fruit, as you say. What are the things that need urgent attention, and where can we find some quick wins? Where are the things we're already doing well? So in that way, the toolkit can actually be leveraged as a means of benchmarking to see, what are some things that we're already, addressing in this organization, and where are some things that aren't even on our radar that we need to focus on. I think the toolkit does provide, there's been a lot of, I would say, an enthusiastic response to the toolkit. There are organizations that have used it for their organizational wide strategic planning, others that have used it for their nursing practice council as a means of focusing activities. And this can be done at the organizational level, at the regional level, across several different institutions. And certainly, I'd love to hear examples of educational opportunities and health service organizations partnering in implementing the toolkit as well. So I think it's a bit of a choose your own adventure. There's no one size fits all, but I think there's lots of opportunities. And I will say we are doing a sort of implementation analysis of the toolkit as well to see, to try to capture those success stories and the so what, how, what difference it made for nurses across the country.
That will be great. I'm sure people will be really interested to hear about what's working well in different organizations. Yasu, Don, did you want to weigh in on any key takeaways or final messages?
So Don here, this is a former educator. I would suggest looking at the tool and just seeing how you can indeed incorporate it into your educational practice. I would say Kaz and you were part of the whole healthcare ecosystem. So in one part of the system works well, the other, the systems theory kind of stuff. So that's what I would say, is just see how you can look at the tool and see what bits and pieces you can use in your educative practice, whether it's more on the theory side or the practice side, but just how it can be used. How it can be used.
I would say as a student that I would really want to encourage both educators and students to look closely into the various initiatives and strategies outlined in the toolkit. And as it has been said before, try your best to pick out what is most relevant. Of course, some of the initiatives or strategies may be very broad or higher level, involving the recruitment of staff, bigger organizational and policy change that might seem disconnected from you as an individual student or educator. But there are still many relevant initiatives, such as the initiative around zero tolerance for bullying, racism, and violence, as well as other factors, such as the topics on leadership and safe staffing practices that I feel can be very pertinent and relevant to an individual student who is going to be working in the actual nursing workforce very soon, either as a uni or HCA, or as eventually as a new graduate. So I think there are many takeaways that could be derived from the toolkit, and I encourage you to be part of this process and critically look into seeing how this could apply into your future practice as a future nurse. So yeah, those are my comments.
Amazing.
Christine, can I just point out in the chat, someone asked, where can we find the sample CNIO role overview?
The Canadian Nurse Informatics Association, CNIA. Let me see if I can link it really quickly, but I know they have, they can connect you. And if that fails, Tracy Riesling from the University of Calgary is probably the national expert on this topic.
Okay, well, if our presenters are okay, I think I got to the thanks for catching that comment there, Don. I think we got through the questions that were received, and I just want to comment on the fact that it's so wonderful to come together with folks across the country to learn what's going on in different provinces and territories and hear from that perspective of practice education and the nursing students. To see how we can best use this really important resource in the Nurse Retention Toolkit. So thank you so much again, Lee, Don, and Yasu. And oh, Lee, go ahead.
Sorry, I just wanted to reiterate my thanks to CNSA and Kazan for hosting this early in September. And I also want to thank all of you for being here today and for the essential work you're doing in educating. There's not a single person in Canada who will not need to avail themselves to nursing services. So this is really legacy work that we're doing every day in educating the future health professionals. And I phrase it like that because I think it's that important. It really is about the future of people in Canada. And I know it's really, really hard right now. And we're working very hard to make things better. But I just want to really take a moment to acknowledge the essential work that you're all doing every day. It does not go unnoticed, and really appreciative of all of the efforts in turning the ship around, as it were.
Awesome. Thank you for that. Thank you for that, Lee. That's wonderful. Okay, well, with that, I'll just remind everyone that we're going to circulate a recording of the session in case you want to revisit it or share it with your colleagues. And I'll wish everyone well and take care and have a wonderful afternoon.